She refused treatment. Minutes later, she started seizing during childbirth. A healthy young woman was about to become a mother. She was only 26 years old, 9 months pregnant. The delivery had already begun. Doctors prepared for an emergency Caesarean section. Everything appeared under control. Then, without warning, her entire body began shaking violently. She started having seizures. Right there, on the operating table. Doctors suddenly found themselves fighting to save 2 lives instead of 1. What caused a healthy pregnant woman to suddenly develop life-threatening seizures during childbirth? The answer lies in one of pregnancy's most dangerous medical emergencies, a condition every pregnant woman should know. The young woman had attended her very first antenatal clinic at 36 weeks of pregnancy. Let's pause there. Antenatal care simply means the routine health care a woman receives during pregnancy. These visits allow doctors and midwives to monitor both mother and baby, detect complications early, and provide treatment before problems become life-threatening. Unfortunately, this was her very first visit. And doctors immediately discovered something alarming. Her blood pressure measured 190/120. That is dangerously high. Doctors call this hypertension. Let's break that down. Hyper means high. Tension refers to pressure inside the blood vessels. Hypertension simply means high blood pressure. During pregnancy, very high blood pressure can damage almost every organ in the mother's body, including the brain, the kidneys, the liver, and even the placenta that supplies oxygen and nutrients to the baby. Doctors also tested her urine. The results showed protein. Doctors call this proteinuria. Let's simplify that. Proteinuria means protein leaking into the urine. Normally, your kidneys act like tiny filters. They keep protein inside the bloodstream. But when those filters become damaged, protein begins leaking out into the urine. And when dangerously high blood pressure is combined with protein in the urine after 20 weeks of pregnancy, doctors begin worrying about a condition called pre-eclampsia. Let's break that word down. Pre means before. Eclampsia is a severe complication involving seizures. So pre-eclampsia literally means the stage before seizures develop. But don't let the name fool you. Pre-eclampsia is already a medical emergency. It can silently damage multiple organs before obvious symptoms appear. Doctors admitted her immediately. They recommended treatment. One of the medications was magnesium sulfate. What exactly is that? Magnesium is a naturally occurring mineral. Sulfate is the chemical form used in medicine. This medication is one of the most important drugs in obstetrics. Not because it lowers blood pressure, but because it dramatically reduces the risk of seizures in women with severe preeclampsia. In many cases, it saves lives. But something unexpected happened. The patient decided to go home first. She wanted to inform her family, gather her belongings. Later, she returned. Doctors again recommended treatment, but this time, she refused the medications. That decision would soon change everything. Before we continue, if you enjoy real medical mysteries explained simply, subscribe to Health Casefile. Every week, we transform real medical cases into life-saving health awareness that could help protect you or someone you love. Now, back to the mystery. The next day, the baby's heart rate began slowing. Doctors call this fetal bradycardia. Let's break that down. Brady means slow. Cardia refers to the heart. Fetal bradycardia simply means the baby's heart was beating more slowly than expected. That can be a warning sign that the baby is not getting enough oxygen. Doctors decided they could not wait any longer. An emergency Caesarean section was necessary, also called a C-section, a surgical procedure used to deliver a baby through an incision in the mother's abdomen and uterus. To keep her comfortable, the anesthetist used spinal anesthesia. What is spinal anesthesia? Instead of making the patient completely unconscious, a small amount of medication is injected around the nerves in the lower back. This numbs the lower half of the body while the mother remains awake. It is commonly used during Caesarean deliveries because it is generally very safe for both mother and baby. Everything was going according to plan. Until it wasn't. Only minutes after surgery began, her body suddenly stiffened, then shook violently. She developed generalized tonic-clonic seizures. Let's simplify that. Generalized means the entire brain is involved. Tonic describes the stiffening phase. Clonic describes the repeated jerking movements. In other words, her whole body was convulsing uncontrollably. The pre-eclampsia had progressed into something even more dangerous. Eclampsia. What exactly is eclampsia? Eclampsia is the development of seizures in a pregnant or recently delivered woman with pre-eclampsia that cannot be explained by another medical condition. It is one of the leading causes of maternal deaths worldwide. Without rapid treatment, both mother and baby may die. Doctors acted immediately. They administered diazepam. Let's explain that. Diazepam is a medication that helps calm abnormal electrical activity in the brain. It can stop seizures by slowing excessive nerve activity. The first seizure stopped, but only a few minutes later, another seizure began. More medication was given. Fortunately, the convulsions finally stopped. The baby had already been delivered safely, but the danger was far from over. The mother was transferred to the intensive care unit, often called the ICU. This is the part of the hospital where critically ill patients receive continuous monitoring and specialized treatment. For the next 2 days, doctors watched closely. Would another seizure occur? Would her organs begin failing? Thankfully, they did not. She gradually recovered. And several days later, both mother and baby were able to go home. But doctors later reflected on one important question. Could this emergency have been prevented? The answer, very likely, yes. The case report explains that early diagnosis and prompt treatment of severe preeclampsia, including medications such as magnesium sulfate, can prevent many women from progressing to eclampsia. So, what actually causes preeclampsia? Scientists still don't know every detail, but they believe the problem begins with the placenta. The placenta is the organ that connects mother and baby during pregnancy. It supplies oxygen and nutrients while removing waste products. In preeclampsia, the blood vessels supplying the placenta do not develop normally. This causes widespread inflammation and damage to blood vessels throughout the mother's body. That damage raises blood pressure, reduces blood flow to organs, and may eventually trigger seizures. Who is at greater risk? Women having their first pregnancy. Women carrying twins or triplets, women with chronic hypertension, kidney disease, diabetes, obesity, women over 35, or women with a previous history of preeclampsia. But remember, it can also occur in women with no obvious risk factors. What warning signs should never be ignored? Severe headaches, blurred vision, seeing flashing lights, swelling of the face or hands, persistent upper abdominal pain, shortness of breath, sudden weight gain, very high blood pressure, or reduced fetal movements. Any of these symptoms require immediate medical attention. Can preeclampsia be prevented? Not every case can be prevented, but the risk can often be reduced. Attend antenatal appointments early. Keep every scheduled clinic visit. Monitor blood pressure regularly during pregnancy. Take prescribed medications exactly as directed. Maintain a healthy weight before pregnancy. Control diabetes and chronic hypertension. Avoid smoking. Follow your healthcare provider's advice. And never ignore warning signs. Most importantly, never delay seeking medical care. Because minutes can make the difference between life and death. This story teaches us something powerful. Pregnancy is natural, but it is not without risk. Sometimes, the most dangerous complications begin silently, without severe pain, without obvious warning, and sometimes, the treatment a patient refuses is the very treatment that could save her life. Fortunately, this mother survived. Her baby survived. But not every family is that fortunate. If you learned something from this story, subscribe to Health Casefile. Because every symptom tells a story. Every disease leaves clues. And sometimes, understanding those clues could save a mother, a baby, or someone you love. Disclaimer: this video is for educational and health awareness purposes only. It is not medical advice. Always consult a qualified healthcare professional regarding pregnancy or any medical concerns.